Congressman Mike Pence is with us, Indiana Republican, to talk a little bit more about this issue. Chairman of the Republican Committee, the Republican Conference Committee. Congressman, what do you think so far of the changes you've heard of?
Good morning, Jenna.
Good morning.
Well, quite frankly, it sounds like government-run insurance 2.0, Jenna. I mean, what we have seen from press reports that is now beginning to emerge from weeks and weeks of negotiations between Democrats behind closed doors sounds an awful lot like the government takeover of health care that the American people rose up almost with one voice this summer to oppose. I mean, what we're seeing here is government-run insurance, mandates for businesses, an enormous tax increase, most of which, or at least half of which, will be paid for by small business owners. You have funding for abortion. You have news reports of the planned cuts in Medicare, especially Medicare Advantage. You know, we think this is a welcome moment this morning. The Democrats will bring out their freight train of a big government-run health insurance plan, and Republicans are going to continue to raise the curtain on what we believe will resonate with the American people.
Okay,
which is allow Americans to purchase across state lines, bring about medical malpractice reform, and the kind of modest, reasonable, responsible reforms the American people really want.
Okay, you described it as a freight train, and that's probably a good analogy just to work with a little bit here. With the freight train, either you try to stop it or you got to get out of the way. So what is your strategy going into some of these talks?
Well, I think we're gonna learn with every. It's pretty astonishing when you think about it that 178 men and women that represent the better part of half of this country have meaning Republicans in Congress, have absolutely no idea what Democrats are going to unveil in a half hour. But we're going to wait and see. We're going to look at it, but we're going to jump in front of that freight train on behalf of the American people. The American people don't want government-run insurance. They don't want a government takeover of health care. Republicans are going to dig in. We're going to make sure the American people understand and count the cost of what they're doing, and we're going to be offering our alternatives.
All right, so if you're going to jump in front of that train, then what are you going to compromise on?
Well, where it comes to the sanctity of the doctor and patient relationship, there's no compromise. When it comes to piling a mountain range of debt on our children and grandchildren, there should be no compromise. When it comes to creating a government-run insurance plan that'll provide support for health insurance funding of abortion, there should be no compromise on those kinds of issues. But we believe that we could compromise on the kind of modest reforms that allowed the American people to purchase health insurance across state lines, to form new association groups. And I think we could come together in a slim majority with a handful of Democrats and every Republican to bring about reforms that would lower costs. The great irony of what it looks like they're going to unveil with this massive freight train of spending and government and taxes is that there are independent studies, Jenna, that suggest that what the Democrats are proposing in the House and Senate will actually cause health insurance premiums to rise. Republicans think there is consensus to lower costs.
Just a final question here real quick, because you're referencing a report from a major health insurance company, WellPoint, which is in your state. It's the second largest health insurance company in the United States, $26 billion, thereabouts. What do you say to critics that say, hey, listen, you're just trying to push your own agenda because you got this big health insurance company in your state that would be hurt by health care reform?
Well, I don't know that when health insurance companies pass along the cost of new government mandates to consumers, I don't know that health insurance companies are hurt. I know consumers are hurt. And that WellPoint study, and you're right, it's the largest provider of insurance back in my home state of Indiana and a lot of states, their actuaries did a massive study, I think it's about 250 pages long, and they determined that younger Americans and individuals could see their insurance premiums triple. A family of 4 could see their insurance premiums double if the Democrats' health care plans are passed. So, I know it'll hurt consumers. I know it'll hurt families and small businesses when the insurance companies pass those costs along. But, the American people, again, whether it's seniors with cuts in Medicare Advantage or whether it's passing along mandates that'll raise the cost of health insurance, we all just need to count the cost before this freight train of a government-run insurance rolls over the American people and future generations.
We're back to the train again. Congressman, thank you very much. Congressman Mike Pence, appreciate it.